Welcome to the PD Pet Care Vlogs. I'm Dr. Cath Watson. I'd just like to talk to you today a little bit about the respiratory grading scheme that is coming in through Dogs New Zealand for brachycephalic breeds in New Zealand. So this is for Bulldogs, French Bulldogs and Pugs. So the respiratory function grading system was developed in the UK specifically for brachycephalic breeds, so the Bulldogs, the French Bulldogs and the Pugs. What the scheme does is assess the presence and the severity of BOAS. So this is the brachycephalic obstructive airway system. So it's assessing how well they breathe, essentially. The reason for bringing in the scheme is aimed at responsible breeding. So this is to try and reduce the incidence in future generations of BOAS from developing. So inheritance is not fully understood yet, but this is one tool that we've got right now that can help us understand better which dogs are actually affected and try and reduce the need to breed from those dogs, so try and reduce the production of puppies that are likely to be moderately, even severely affected as they grow. So the scheme is going to be administered by Dogs New Zealand. There are regionally approved veterinary assessors, and you can find those assessors in your region on the Dogs New Zealand website. Dogs are assessed from 12 months of age, and then the recommendation is to repeat that assessment every 2 years for life or until you stop breeding from them. So there's two parts to the grading scheme. So first up, it involves an examination where they are relaxed, not stressed, not exercising, and the chest is auscultated, they're observed breathing and graded as far as how much difficulty they appear to be having, how much noise is produced. Then they are made to exercise at a quick pace for 3 minutes, and that may be by the vet, it may be by you as the breeder with them, it may be by somebody else who's happy to run around for 3 minutes at a quick pace. And then they're assessed again. So again, the amount of noise they're producing and what the chest sounds are like, how much difficulty they appear to be having getting air in and out. Then they're giving a grading from 0 to 3. So 0, they're completely unaffected. They're breathing like any other normal long-nosed dog. 1, they're unaffected, but they may have mild symptoms. 2, they're affected and the symptoms are moderate. 3, they're affected and there are severe symptoms of BOAS, so they're really having trouble breathing. They may not even be able to complete that 3 minutes of exercise. They may not even be able to start it, to be fair. So with that grading, the aim then is to try and breed from the lowest grade dogs that you can. So ideally a 0-0, preferably not a 2 or a 3 used for breeding purposes. However, obviously with any breeding you need to take into account other considerations, so temperament, general conformation, other genetic tests that may have been undertaken as well, and you need to look at the big picture. So it may be that you do choose to breed from a dog who is graded as a 2, but ideally then breed them to a dog that has a lower grading, so a 0 or a 1, to try and minimise the impact of that of those BOAS symptoms affecting the puppies as well. So I hope that helps you understand the respiratory function grading scheme. It is designed to help improve these brachycephalic breeds for everybody for the future, and obviously give them a life of being able to breathe easy.